Question 124. Blood supply of CNS. Here you see the spinal cord and its arteries. In the vertebral canal it is supplied by spinal rami of lumbar arteries, posterior intercostal arteries, vertebral artery, and deep cervical artery. The vertebral and deep cervical artery comes from subclavian artery. The numerous spinal branches join to form anterior spinal artery. This is anterior spinal artery on the anterior surface. And this gives branches named sulcocommissural arteries running transversely in anterior longitudinal fissure to supply mainly gray matter. Then you have posterior spinal arteries. There's two of them. You have right and left, and they are placed near the posterior spinal roots. Now the veins of the spinal cord joins to form the internal vertebral venous plexus, contained inside the vertebral canal, and the intervertebral veins arise from this venous plexus to terminate mainly in vertebral posterior intercostal and lumbar veins accompanying their arteries. Now the blood supply of the brain. You have main vessels supplying the brain are vertebral arteries from the subclavian artery, vertebral, and internal carotid artery coming from the common carotid artery. Now the vertebral artery enter the cranial cavity through the foramen magnum, giving branches for spinal cord oblongata and cerebellum, and joins to form the basilar artery. Here you have right and left vertebral arteries joining to form basilar artery. And the basilar artery is placed on the inferior surface of pons and gives branches to pons, cerebellum, inner ear, and it divides into posterior cerebral arteries. The internal carotid arteries enter cranial cavity through the carotid canal. It goes through the cavernous sinus and it gives ophthalmic artery, and then it turns and divides into middle cerebral artery and anterior cerebral artery. The two anterior cerebral arteries are connected by anterior communicating branch, and the middle cerebral arteries send posterior communicating branches back to posterior cerebral artery. Now this here forms the arterial circle, or circulus arteriosus, also called circle of Willis. And this gives branches. Here you see a schematic. Here you have basilar artery, posterior cerebral artery, middle cerebral artery, internal carotid, anterior cerebral artery, anterior communicating, posterior communicating. Now this circle gives off cortical branches that run on the surfaces of hemispheres to supply cortex, and it gives off basal branches, secondly, which enter the inferior surface of brain to supply white matter of hemispheres, basal nuclei and diencephalon. And these basal branches are divided into 4 groups: anterolateral, anteromedial, posterolateral, and posteromedial. Posteromedial, posterolateral, anterolateral, posteromedial. Lastly, we have choroid arteries that enter the hemispheres to supply choroid plexus of ventricles of central nervous system. Here you have anterior choroidal artery. Here you can see the choroid plexus of lateral ventricle. And this is the anterior choroidal artery. And this is medial posterior choroidal artery. And this is lateral posterior choroidal artery. The anterior supply choroid plexus in lateral ventricles, and the posterior supply choroid plexus in the third ventricle. And then we have the cerebral veins. The blood from the brain is drained into the cerebral veins. You have superficial cerebral veins, deep cerebral veins, and these veins terminate in sinuses of the dura mater. They are contained inside the meningeal layer dura mater. So to name these sinuses, you have superior ophthalmic vein that goes into cavernous sinus. This is inferior petrosal sinus, superior petrosal sinus, superior sagittal sinus, transverse sinus, sigmoid sinus, inferior sagittal sinus, straight sinus. And all of these sinuses eventually drain into the internal jugular vein. Now the superficial cerebral veins, they drain the white matter, basal nuclei, and they drain blood from cortex. The superior cerebral veins open into the superior sagittal sinus. The inferior cerebral veins opens into the inferior sagittal sinus, and the cavernous sinus, and the transverse sinus. The superficial middle cerebral vein open into the cavernous sinus. The deep middle cerebral vein opens into the basal vein. Which terminates in greater cerebral vein, which drains into the inferior sagittal sinus. Then we have cerebellar veins, which drain into the inferior sagittal sinus and into the sigmoid sinus. The deep cerebral veins, they drain the white matter, basal nuclei and diencephalon. We have thalamostriate vein and choroid vein. Thalamostriate, choroid vein. They form internal cerebral vein. And the right and left internal veins joins to form, here we have internal cerebral veins, we have cerebellum, they join to form greater cerebral vein, which empties into the straight sinus. And just lastly, to see the sinuses of dura mater again. The superior sagittal sinus continues into the transverse sinus. The inferior sagittal sinus opens into the straight sinus, and this opens into the superior sagittal sinus. The transverse sinus continues into sigmoid sinus, which terminates into the internal jugular vein. The cavernous sinus opens into the inferior petrosal sinus, which terminates in internal jugular vein. Cavernous sinus also opens into superior petrosal sinus, which terminates into the transverse sinus. And you have a sphenoid sinus that opens into the cavernous sinus.